Hello and welcome to OralVision, a cost-effective breakthrough for oral cavity cancer patients. Every year, over 177,000 people die from oral cavity cancer around the world. Even though modern therapeutics have made the disease one of the most treatable forms of cancer, nearly 70% of cases are diagnosed in the later terminal stages, largely due to diagnostic uncertainty and socioeconomic inequities. The oral cancer screening market is dominated by fluorescence-based imaging devices like the Velscope VX and the VisiLight Pro, which use UV light to illuminate potentially malignant tissue in the oral cavity. However, these solutions can cost over $2,400 per unit, an exorbitant price that makes it difficult for clinics in lower income areas to access proper oral diagnostics, forcing them to resort to rudimentary methods like visual examination and palpation that are far less accurate.
OralVision is a handheld, machine learning powered diagnostic device that utilizes a four-layer methodology to detect oral cavity cancer. First, the sensing layer consists of an Argicam 5 megapixel camera, which is controlled by a single medical grade momentary push button to periodically take images of the patient's oral cavity. Next, these images are sent to the processing layer where a microcontroller compresses and filters them based on quality. These images are then sent over using Wi-Fi or USB based on the physician's needs to the inference layer, where a Raspberry Pi 5 mini computer analyzes the images using a federated neural network that retrained to detect oral cancers visually. This model is different from others because it maintains HIPAA compliancy. User data is stored locally on the device while only the model's parameters are updated in a central terminal, protecting user personal identifiable information while continuously improving the device and its capabilities. Finally, the diagnostic predictions and their probabilities are displayed on a screen for the physician to use during their final diagnosis. Pictured here is the V1 prototype of our actual device, which we 3D printed and assembled 2 months ago. It's intuitive, lightweight, and cost-effective. The market for such a device is quite significant. The global intraoral cancer diagnostic market is valued at over $535 million as of 2025. In addition, more than 380,000 cases of oral cancer are diagnosed each year, with this number only on the rise. While oral cancer is prevalent in communities around the world, especially those that are underserved, we plan to concentrate our marketing efforts on South Asia, a low-income region that has a history of increased oral cancer risk due to unhealthy lifestyle choices such as tobacco use and betel nut consumption.
OralVision has a variety of unique features that competitors like Velscope and VisiLight don't offer. For instance, OralVision employs federated learning to constantly reinforce its AI model by collecting HIPAA-compliant patient data, while competitors lack any mechanism for diagnostic improvement. The device also incorporates computer vision algorithms in its neural network to guide medical professionals and make an accurate diagnosis, while fluorescent-based devices like Velscope and VisiLight merely illuminate oral tissue and ultimately rely on the physician's naked eye for final diagnosis. Furthermore, in regard to comfort, OralVision offers a superior 3D printed design for oral ergonomics, while existing solutions tend to be bulkier and uncomfortable. Despite all of these benefits, OralVision has a retail price of just $749.99, over 3 times cheaper than Velscope VX and VisiLight Pro. Even with OralVision's low price, its capabilities exceed major competitors by a significant margin. We ran multiple trials to validate our AI model's accuracy and found that it has a cancer identification accuracy of 87.15%, 1.64 times better than Velscope. We also had an F1 score of 0.8655, 1.26 times better than Velscope. The total production cost for our device is $503 due to its use of cost-effective electronic components. We also estimate a regional shipping cost of $18.25 through FedEx's Express Saver program. We have a 33% profit margin for reinvestment into our research and development and manufacturing operations, allowing for continual improvement and growth. In Q4 of 2025, we formed OralVision and started development of both the device and the machine learning model, seeing the struggles low-income members of our community face. In the ongoing fiscal quarter, we have so far validated the accuracy of our model in experimental trials and are in the process of filing a provisional patent with the USPTO. In Q3 of 2026, we plan to create a crowdfunding initiative to raise at least $50,000 to fund initial manufacturing efforts. In Q3, we will file for FDA 510K pre-market clearance, which is required for Class 2 medical devices like OralVision to be introduced to the market. We'll also provide the device through a pilot program to local clinics, getting crucial testing data and user feedback, which we will use to help develop OralVision V2 in the 4th fiscal quarter. By Q1 of 2027, we hope to file a more permanent utility patent with USPTO for our device and begin mass production of OralVision V2 for distribution worldwide. Thank you for considering OralVision.